Hi, my name is Mary Vasilaki. This is my daughter Marina. I'm a breast cancer survivor. We live in New York, and the protocol for breast cancer mammograms is starting at the age of 40 and annually. So every year I've been doing my mammograms, and there has been no issue. At some point when I was 45, they found a mass. So I had to go and follow up with biopsies that confirmed it was positive, and I had breast cancer. It was caught very early. It was really tiny 6 millimeter tumor. And at that point, of course, after the first shock, I had to find out more about breast cancer, educate myself, learn what I needed to do, work with different doctors, make sure that I'm comfortable with the doctors that I was working with. There are a couple of tests that I did after the surgery. They pretty much tested the tumor for a couple of things. So the first one was they did the genome testing to make sure to find out whether it was hereditary and what type of cancer it was. It was of most importance to me how this would affect my daughter's life. So for the genetic test, it was the results showed that it was not hereditary. I did not have breast cancer history in my family. So that was great. And at that point, the doctor informed me that for my daughter, what really that meant is that instead of starting her annual mammograms at 40, she would have to start 10 years younger than when I was diagnosed with breast cancer. So I was diagnosed with breast cancer at 45. She would just have to start her mammograms at 35. Another test that the doctor suggested that I do before I start treatment post-surgery was the oncotype test to make sure that the best treatment was presented to me. When the results came back, it was clear that I didn't have to do chemotherapy, which is what they were initially expecting. Then I just did radiation for 6 weeks, and that was it. So this was almost 3 years ago to the date, and I've had a couple of mammograms since then that have been clear, so there is no risk. It was, as I said, very small. It was caught early, so it's definitely very important for all women to make sure that you do your tests. Make sure that if there is a chance of breast cancer, it gets caught as early as possible and treated as soon as possible. That increases the percentage of living a long and healthy life. You have to do tests on your breast during the year by yourself. The doctor can kind of guide you on what you need to test and what you should be checking for. But all women, we need to know what feels normal and what doesn't feel normal. Definitely eating healthy, exercising as much as you can, minimizing stress, which is a blanket statement, I guess. And how do you minimize stress? But you have to try to do that. When it comes to breast cancer prevention, what I would advise my daughter would be to, as often as you can, make sure that you're comfortable with your breast. stand in front of the mirror and take a look at the breasts. Make sure that you don't feel something that's different, something that doesn't look right. And even if you're in doubt, just check with your doctor. You eliminate any possibility of something going wrong before you start your mammograms. And once you start your mammograms, Marina will start it at 35. Make sure you don't miss one. You know, we're all active, we're all busy, we're all, you know, life. So making sure that that's the priority in your life is very important.
When I found out my mom had breast cancer, there were a million questions running through my head, including, would this affect me? Would this affect my children? How is this going to look for the next few months? And it was very stressful. So I did attend a few doctor visits with her. So watching them take blood from my mother and putting them in little tubes and then sending them off somewhere we had no idea where we're going was very stressful. So I heard of breast cancer before, but when you hear of cancer, I feel like it already automatically goes to something being fatal and something that usually ends someone's life, which is not necessarily true. Like my mother said before, when you start early, you catch it early, it makes this process a lot less stressful. As my mom said earlier, I will be getting tested starting earlier, and I will make sure to go every single year, because I've seen other families that maybe have started testing earlier, didn't take it as seriously, and it ended up being fatal and being a bigger challenge in their life than it should have. So I think it's extremely important to be tested, because once again, even if you don't feel like something's wrong, there could be something there that could be potentially something huge. So it's very important to be tested, and especially to be a role model for kids, because you want to take whatever precautions you can to prevent something so big, because I feel like cancer is a very big part of our society, and everyone knows someone who has had cancer or who has died from cancer. Every single person. It is a known fact. So I'm sure everyone has seen how lethal it can be onto different families and different people. So just dedicating a bit time for that can make a very huge difference in someone's life. So this summer I was lucky enough to have an internship at Genekor. So what did I learn? I learned different testing processes, such as the one that my mother went through, which was taking the biopsy. Where does that tumor go? How is it tested? I was lucky enough to see that. I was lucky enough to see different scientists looking at the results and taking time and care and checking it and double checking it and making sure they're sending the right results. How does the hereditary cancer process get tested? So I watched that too. I watched how the genes are tested to see if there is a mutation. Where is the mutation? How severe is the mutation? And then I watched the results get sent back. So this just helped me feel a lot more trusted with the process, because once again, someone's taking your blood and just sending it somewhere, and you don't know where that is, and you don't know what's going to happen, because these scientists daily are being put to be tested different results to maybe send a life-changing result back to the patient. So they have to be very careful. And I saw scientists do the testing process over and over again to make sure the correct results are sent back, so then the correct steps could be taken for that patient.
To women battling with breast cancer, it's 100% treatable most of the time. Just do your research, try to keep yourself sane, don't get lost in the process. You have to follow the steps, you have to follow what the doctor is telling you, but you have options. You can speak to as many doctors as you can, pick one that you feel comfortable with, and establish a relationship. It's a long ride, I have to say, but women are survivors. We're very strong, and it's something that I'm hoping will eventually get eradicated, hopefully in the next couple of generations.
For women battling breast cancer at this moment, I would like to just say, do your research, see what you can do to minimize what you're about to go through. All your trust must be put in your doctors, but that doesn't mean that you shouldn't look and get opinions from other doctors too. That was very important for us. Don't rely on just one doctor. Make sure you get a few opinions. You need to take the right steps to make sure that the hardest challenge in your life can become easier than it would have been if you weren't taking the right steps. For your family and for yourself, you have to stay strong and you have to look for support. If you want to talk to someone, really helps, because it is not the end of the world. And, you know, everyone's out here looking for you. That's what the job for these scientists, these doctors, these diagnostic centers are for. They're to look for, their job is to look out for you and make sure you're getting the best treatment and help you need.